Thank you, sir, and thank you to Sages and for everyone for sticking it out here. We're going to kind of continue discussing a little bit of what we've already talked about today, our differences in the ways that we go about repairing our hernias. So beginning first with laparoscopic and now, we have nothing to disclose. Beginning with laparoscopic and now robotic surgery, advances in minimally invasive approaches have decreased overall costs and improved patient outcomes. Simultaneously, the healthcare industry in the United States and around the globe has continued to grow, such that the healthcare sector is inextricably linked to local, national, and global economies. The U.S. healthcare sector industry's share of GDP is expected to rise to 19.4% of total GDP by 2027. And importantly, both the growth in minimally invasive technique and the financial optimization of the healthcare system have pushed forward without consideration or quantification of the environmental impact of both. Meanwhile, climate change in the form of drought, floods, increasing strength and frequency of extreme climate events, etc., and I just waited till this morning to make this slide, importantly, abound, while indirect public health effects are manifest in worsening air pollution, increased incidence of vector-borne disease, diarrhea, malnutrition, and the list goes on. Consideration of healthcare's environmental impact becomes necessary in this context. The healthcare sector accounts for 4.4% of global CO2 emissions and between 8 to 10% of total U.S. emissions. If considered an independent nation, the global healthcare sector would represent the 5th largest greenhouse gas emitter in the world, and the U.S. healthcare sector's emissions are estimated to account for 614,000 years of healthy life lost annually, also known as disability-adjusted life years or DALYs. Nearly all previous studies have looked at emissions or waste production at the point of care. For example, how much energy is used to run an operating room or how much solid waste is generated by a single procedure. While this is a good and necessary start, recent data suggests that up to 71% of the environmental impact associated with the healthcare sector is buried in the industry supply chain. So we sought to capture the impact associated with what is known as the life cycle of the products and services associated with 25 cases each of robotic and open ventral hernia repairs. So this is a bit of a busy slide, but it represents the boundaries of the life cycles considered for our research. The column sort of toward the middle, left of the middle there, represents an intraoperative products and processes, but you can see much further to the left as well as to the right, we tried to incorporate as much of the entirety of a life cycle from what is called the cradle to the grave in order to better quantify the associated environmental impacts and identify areas for mitigation. Quantification of the environmental impacts across these broad life cycles can be completed using a method known as economic input-output life cycle assessment. A brief introduction to this, the entire U.S. economy is broken into 480 sectors such as transportation, banking, surgical, appliance and supplies manufacturing, etc. Monetary inputs and outputs between these sectors capture the flow of goods and services in a given economy. To demonstrate this, these are the economic sectors that provide inputs for the delivery of a single robotic ventral hernia repair and the percentage of greenhouse gas emissions associated with each sector. You can see there are many there, and the third largest in the gray represents all the others that contribute as well. Generally speaking, to produce a product in one sector, inputs from many other sectors are required. Each sector then has environmental impact specific to that sector for each dollar of output. So the overall environmental impact for a product or service can be calculated with the following equation, which put simply represents the sum of all inputs and associated environmental impact required for a single dollar of output from a given economic sector. The environmental impacts are split into several previously determined subcategories, from global warming to respiratory effects to human health effects in the form of increased oncogenic potential. Each unit in these subcategories can be associated with a disability-adjusted life year value, and you then have the ability to equate environmental effects to a tangible human health impact. So after all that big introduction, here are our results. Overall, robotic ventral hernia repair demonstrates significantly larger environmental impacts across all impact categories. And of course, there's a lot of data that came from this, and just to parse out a little bit more of it here for you, each ventral hernia done robotically generates about a 144% more greenhouse gas emissions. Supply chain related transportation accounts for 26% of the total emissions for robotic repair and 24% for open. Energy associated extraction, refinery, and generation accounts for 39% of robotic CO2 equivalent emissions and 45% for open repair. Overall, the total energy expenditure associated with a robotic repair is 143% greater, an additional 1.4 barrel of oil equivalents per procedure. As far as disability-adjusted life year impact, a robotic repair is associated with nearly a twofold increase in disability-adjusted life year reduction. So how do we think about this in the larger context of healthcare delivery and specifically hernia repair? First, some additional data to consider as we discuss this. The WHO estimates that the climate change will directly cause an additional 250,000 deaths by 2030, and that's on an annual basis, and that US healthcare emissions associated dailies reduction of 614,000 can be reframed to say that that represents at least 44,000 incremental deaths annually, a number that is akin to the number of annual in-hospital deaths caused by preventable errors. But as we know, healthcare, and specifically surgery, make innumerable positive impacts from both a climate and health standpoint. For example, a UK study found that surgical treatment of GERD has a smaller carbon footprint than medical management after 9 years of medical management. And previous studies, mostly performed in sub-Saharan Africa, have suggested that each hernia repair adds about 9 disability-adjusted life years. So I think this leaves us with the following question: what role do surgeons have really as a consumer of many products and processes in combating climate change? Many would suggest that we need to maintain focus on the single patient, but also consider the impact of our practices on others. We have an opportunity to redefine who our patient is, not just the individual on the table, but also many others around the globe and even future generations. So in conclusion, robotic ventral hernia repair demonstrates outcomes advantages, but produces higher environmental impacts compared to open repair. Data to date suggests that the impact of the procedure far outweighs specific associated public health effects, at least specifically in the realm of disability-adjusted life years, but that the effect on population health is not insignificant, especially when you consider the hundreds of thousands of repairs that are done each year. Surgeons, administrators, and policymakers should partner with suppliers to explore materials and process alternatives, especially in the sector's supply chain and energy sources, to avoid or mitigate climate-related social and public health effects during the widespread adoption of robotic surgery. I'd like to thank everyone for the opportunity to present our work. We'd also like to thank SAGES for the ongoing grant support in this project, and I'd be happy to answer any questions.